it's Megan, everyone's favorite trauma nurse, right? So today I thought I would go over a topic that I thought might be interesting to some of you guys. Travel nurses versus staff nurses. I've actually been both, and they have their good points and bad points, so thought maybe you guys have some interest in it. I know I have opinions on the good sides and the bad sides both, so anyway, but first of all, I want to send a little shout out, Michigan State. I'm from Lansing, hence the very nasally Midwestern accent that confuses the hell out of people here in Virginia. But anyway, whatevs. So, got my list. I'm gonna go over it right now. So, right now, currently, I'm doing the travel nurse thing. Pros about being a travel nurse. First thing, money. All about the money. You get paid a lot more, and if you got bills to pay, you got rent, you got kids, it definitely pays to be a travel nurse. That's very first pro. Pro is the money. Flexibility. Second tip. I mean, you can do contracts anywhere from 3 weeks, 4 weeks to 13 weeks, and you can even extend your contract if you like the place. So there's a lot of flexibility versus being a staff nurse. And if you're like me and you're not big into commitments, it's great. You do 13 weeks in a joint, you don't like it, you don't like the people, you don't like the location. If you don't like the electronic medical record, you do your 13 weeks, boom, you're out. I mean, done. That part I really like. I mean, because if I don't like some place, one and done. I don't extend a contract and I'm gone. And that meeting new people, I mean, that's cool. You meet people from different walks of life if you go to different parts of the country. I mean, that part is awesome. You can extend your contract. That's a pro. If you do find that you're at a place that you like, you can extend your contract. You can work in one place for up to a year. In an area, I should say, without affecting your tax bracket, because travel nurses do get special tax breaks. I won't get into all that because, frankly, I'm not about the tax, explaining taxes and the shit to you guys. I mean, that's not my bag. Let's see. Another thing I like about it is you see new ways of doing things. You learn new things that maybe hospitals you worked at before weren't doing. One thing that I learned when I was working at the Cleveland Clinic, I learned that another hospital that I was working at was not using the best anticoagulation medication for STEMIs. So, of course, Cleveland Clinic being the heart hospital, I learned that this was the preferred drug. Other hospitals weren't using it. So learning new things, great. I really, really like that. Now you also will learn sometimes that the hospital isn't learning or isn't using great things, but that's not part of the pro list, so let's stick with that part right now. You don't get caught up with the administrative bullshit, and let's face it, if you've been a nurse for a while, there's always administrative bullshit. Staff meetings and all the other type of stuff that comes along with the administration. You don't get caught up with that kind of crap when you're a staff nurse. You're there for 13 weeks. Your first week is usually orientation, so we're talking 3 months. 3 months is not enough to get caught up with administrative crap. You don't have to do their 1-year competency fairs, and you don't have to go to, at least one staff meeting a month or whatever. You don't have to get caught up in that silliness. And let me tell you, that is like the best thing about working as a travel nurse, other than money, is you don't have to deal with that kind of trifling shit. Okay? The cons. here comes the bad part about being a travel nurse is what it can get lonely. If you're in another city, another state, way far away from your friends, your family, it can get kind of lonely. You miss your pets if you don't take your pets with you. When I do travel nursing, you know, my kids are 16 and 21. One's living in the college dorm, so I don't get to see him as much. You know, I come home every couple, you know, thankfully I'm traveling not so far that I can't come home maybe once a week or whatever, to see my cat and my dog, you know, my husband and my 16-year-old. But right now, the financial part is why I have to do it. So I get really lonely though. I miss everybody. So that sucks. And you get treated as an outsider. You are not part of the crew. You're just, you know, you're the new person, and until further notice, you are the outsider, and you're treated as such. And let me tell you, you will get the shitty assignments. Oh, you got the crazy person who's acting nuts and trying to beat somebody with a chair. Oh, we'll give that patient to the travel nurse. And I have heard it, overheard it, from charge nurses and whatnot. And when they think that we're not listening, or they forget that we're there, they don't know we're behind and they hear about a really awful patient load or a horrible patient, we'll give it to the traveler. I've heard it right out their mouth. They will give you the shitty assignments. Let's see. Staff nurses resent you. Why? Because sometimes you are making between, sometimes more, $10 more an hour, sometimes $20 more an hour, sometimes $30 more an hour than they are. So they will resent you. And sometimes they will talk shit about you. You can hear it. They will complain, you know, and you will overhear it. And I usually just, you know, just keep my mouth shut, because, you know, I don't want to go, as I call it, all lancing on somebody and let that part out. So, because you are a guest in their hospital, and, you know, so, yeah. But they will treat you as an outsider. They do resent you. Not all of them. Some of them are glad you're there because you are there to help them. Some of them do appreciate you. But not all of them. Some of them will treat you badly. They don't want to help you. If you can't find, and you won't be able to find a damn thing because you don't know where anything is. Some people will help you look for stuff. Some people will be like, it's over there. Last hospital I worked at, honestly, I was treated better by the docs than I was by the nurses. But it is what it is. You signed up for it. So, but I did make some friends there. But not everybody is a fan of travel nurses. You know, it is what it is. The scrub colors vary, honestly. I have Cleveland Clinic wears white, and they don't always provide them for you. Metro Health wears black. That hospital does provide for you, but I was working actually as a staff nurse at that time. But they provide all their ER nurses with scrub, and they do their laundry for you, which was amazing. But that's another story. So I have more scrubs in more colors than I care to know what to do with. Oh, and sometimes they don't have Epic. And I tell you what, this video is not sponsored by Epic, but Epic, if you're listening, I love you. There's a reason why 19 of the 20 best hospitals in the US are using Epic. I love you, Epic. Cerner, well, we just won't go there. So yeah, charting systems are different than what you're used to. The drug dispensing machine, you know, Omnicell, Pyxis, Drugomatic, whatever the hell it is. You know, they're different. You might not be used to it. So there can be a steep learning curve. Frankly, I don't like Cerner. I love Epic. And if they don't have Epic, I'm not happy. But that is. So now I'm over the pros and cons of a travel nurse. Back in the days when I was a staff nurse, the pros, one of the biggest pros of being a staff nurse in the ER, especially as a ER and trauma nurse, the docs know you, they respect you, and they trust you. I worked in one ER for years. In fact, I was a charge nurse there. The docs knew me, they trusted me, they respected me, and if I told them, hey, there's something going on here, a lot of times they're like, well, what do you want? What do you think the patient needs? And I'll say the patient needs this, 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 and this, and they're like, okay, do it. And that was it. Sometimes they would just say, you know what, just order it, do whatever you want. If I said that I thought a patient needed something, they would just let me put the order in and go for it. They knew and trusted me. And if I said, you know what, this patient doesn't look right, I think you need to come look at this patient. If I said that, they came and looked at that patient immediately. With younger nurses they didn't know, they're gonna come look, but they might not. But if I said it, they knew that with my experience, my expertise, that some shit was about to pop off, that something was wrong, because I was, most of the time I was right, because after so many years, you develop that rapport, that trust, and the gut. And if you're an ER nurse, trauma nurse, the gut. If you got a gut and it tells you something ain't right with your patient, something ain't right. Another pro, you're more likely to be promoted if you're a staff nurse, obviously. They're not gonna promote a travel nurse. I started off as a staff nurse, and I ended up as one of the charge nurses. And that doesn't sound like, much of a promotion, but when you consider that I was a charge nurse at a level 1 trauma center, we might see well over 350 patients a day, and we had a White House telephone, and we had multiple helicopter landing pads on top of the ED, in a 1,000-bed hospital, in a major, Washington, D.C., basically. That's not an easy thing to do. You have to have a lot of experience, and you have to be a damn fine nurse in order to be a charge nurse in that kind of ED. So you have to, that's a pro. You can be promoted if you're a staff nurse there. And it becomes like your home. Other nurses become like your family members. There are nurses that I worked with at that hospital that I know if I called them at 3 o'clock in the morning and said, hey, this such and such and such, they would come, because we are your family. I worked with those people for so many years. I saw them more than I saw my family. We've seen the good, the bad, the ugly. We've cried together. We've, we've brought lives into this world together. One girl and I delivered a baby together. Paramedic and I did. And then, we've unfortunately watched people leave this world together. We've tried to stop people, so there's a bond, and they get to be like your family. And those kind of long-term friends that become like your family, you'll never get that as a travel nurse. And there are friends that I made working in that ED that they would do just about anything for me, and I would do just about anything for them. So that's definitely a pro of being a staff nurse at a hospital for a long period of time that you'll never get as a travel nurse. So, yeah, shout out to Carlin and Greenwald. The insurance is less expensive. The insurance as a travel nurse is expensive. Not only is it expensive, when you are working as a staff nurse at a hospital, You know those docs. And when you're in the ED, you know all the docs that come down to do the consults. You know the ortho docs, you know the thoracic surgeons, you know the neurologists, you know the neurosurgeons, you know all the specialties. You know who's good, you know who's not so good. So when it comes to you need something, your kids need something, your baby's mama's, daddy's, brother's, sister needs something, you know who you would go to, who you'd send your kids to, who you'd send your family to, and who you would, you know what I'm saying? So that is a pro. Let's see, con of being a staff nurse. Biggest thing is you get in a rut. You've been working there for umpteen million years and you're comfortable. And when you're comfortable, you don't grow. Some people don't. Some people are naturally driven, but some people, they stay at the same job for 20 years. I can't imagine that. That's not my personality. But, you know, you just get comfortable. You get comfortable. And sometimes, well, in my opinion, if you just get too comfortable, you don't grow. You just don't grow. Oh my God, and the administration. And that's where the BS comes in. When you have to go to the staff meetings and the annual competencies and have, oh God, councils and, oh God, what do they call them? All their little groups that they have. Oh, I can't think of the name for them right now, it escapes me. Whatever. They want you to join this, they want you to join that, and yeah, no. That's not a thing. I don't do that either. I don't join any groups, councils, whatnot. No. No. I don't like staff meetings. In my opinion, staff meetings are usually way too long. People ask dumbass questions, and most of the time, all that shit can be handled in a fucking email. Pardon the language, but I'm an ER trauma nurse. We swear. We swear more than sailors and Marines and cops. So, you know, it is what it is. And clicks. Oh, sweet baby Jesus, clicks. You know what I'm talking about. If you're an ER trauma nurse or any type of nurse, you know there's clicks. And that's, if you are a staff nurse, there's clicks. And that's a problem. Because they get this, you know, if the charge nurse is friends with so-and-so, then they all get to get assignments. And yeah, no, that's, no, not cool. So that's my list of staff nursing, travel nursing, pros and cons. So if you've worked as a staff nurse in the ER, or you are a travel nurse, let me know what your thoughts are. If you have any additional pros, cons that I didn't think about, didn't mention, I would love to hear them. So don't forget to like, thumbs up, subscribe, and leave any comments. I'll be putting out more videos, and till next time, have a good one. Talk to you later. Bye.